Very excited to have Damon Davis with us, who's a special assistant for consumer e-health at the Office of the National Coordinator at HHS. Damon's going to be speaking on health IT supporting engaged patients. Again, one of the themes and what we've been discussing over the past several days has been what are the outcomes of all the IT investments that we're making as a community, and how can these ultimately improve our ability to care for patients, reduce errors, engage them in managing and being involved with their own health. And that's basically Damon's sweet spot. So let me give you a bit of a background about Damon before we get started. Mr. Davis is focused on increasing consumer access to secure electronic personal health information. The OCEH promotes greater access to health information, consumers taking action with their electronic health data towards better health outcomes, and attitude changes on the part of providers and patients and families to promote shared decision-making in a health IT-enabled healthcare system. The 3 A's of consumer engagement through health IT. His works also includes managing the Blue Button Pledge community, which I believe he'll be speaking about in a moment. With that, I'll hand it off to Damon.
Thank you very much, Par. I appreciate it. So Par asked me to, if we wanted to stop and let you guys eat, and I said, no, let's get the folks out of here. So I hope you'll appreciate the fact that I'm trying to get you out of here as expeditiously as possible. Again, my name is Damon Davis. I'm with the Department of Health and Human Services. I'm in our Office of Consumer eHealth. I appreciate you all staying. I can see that clearly the best and brightest and most important people chose to stay to the bitter end, so thank you very much for staying. Our office is dedicated, and my clicker is not moving, so I'm going to, if you don't mind, advance with the button. Is this thing here supposed to be on for the clicker? Yeah. Okay, I can see we've already got jokes. This is going to be a fun final session. Is that supposed to be on there? Because there's no lights.
No, yeah, it's not.
That's always a good sound. Excellent. So let me just test this out real quick. Yep, we're up and running. Okay. So again, Damon Davis, Office of Consumer eHealth, Department of Health and Human Services. I am also from the Office of the National Coordinator for Health Information Technology, like Doug Frisma from Sunday's Talk. I'm going to talk to you a little bit about how health IT is laying the foundation here in the United States for delivery system reform. The bottom line is there are a lot of different initiatives across government and private sector that are related to increasing individual health. But the simple fact is none of them really could be accomplished for true quality improvement without information technology adoption. And so Dr. Don Berwick, before he left CMS, imparted us with a little bit of knowledge as to what his vision was for improved health care in the United States. Better health care writ large. The simple fact is we could all stand to have better general health care when you are in the healthcare system. But then similarly, we also want to focus on our own better individual health. So you and I, as we walk around with our Fitbits and all of these different monitoring devices, are engaged in our own better health, and that is part of the actual process improvement. But then finally, reducing costs. And I'm sure you've talked about this at some point during a conference, the idea that cost reduction is going to be critical to increased efficiency in the healthcare system because the costs are just way out of control for the level of service that we all should be expecting from our healthcare system. I'm going to tell you a little bit about just generally ONC because I'm not sure that everybody knows. Just raise of hands. Is everybody familiar with the Office of the National Coordinator? All right, cool. So just really quickly, I want to make sure you understand some of the resources that are out in the field right now. As a part of the Recovery Act, we funded 62 regional extension centers that are specifically out on the ground supporting providers in adopting electronic health records into their practices. So recognizing that doctors are typically trained in medicine and not necessarily IT, they need resources to turn to say, I need some help. I'm interested in EHRs. I have no idea how I'm going to do it. And one of the challenges that we have to make sure that they do not, that they face properly and that they don't duplicate is when you move from a paper-based system to an electronic-based system that you don't basically digitize problems in your process flow into the new system. So you want to do a process redesign, and that's what the regional extension centers are also helping people to do. The health information exchanges, 56 state-based organizations that are focused on robust exchange of health information. So it's great for one provider to be able to exchange it between another one because there's interoperability between their systems. But obviously, as I travel throughout the United States, I would like for my data to be able to follow me. The patient needs to have their data follow them, and the health information exchanges are specifically focused on that task. Beacon Communities are 17 demonstration projects that are specifically focused on showing that by implementing health information technology, you can actually move the needle and change some health outcomes. So there's been speculation as to whether health IT is really the enabler that we all seek towards better health care. The Beacon Communities are going to prove that health information technology adoption, robust exchange, and care coordination across a community can change outcomes on a population basis. There are SHARP research projects, and basically these are projects that are intended to focus on the issues that are coming in electronic healthcare adoption when we reach the critical mass of adopters in the United States. Things like security, patient-centered cognitive support, application and network design, secondary uses of EHR data. These are all things that we need to consider, and we should be thinking about solving the problems for now so that when adoption is robust, we have already taken care of some of those issues, and we can focus on other things. We have a lot of standards and certification and interoperability specifications that are truly sort of making it so that the efficiency across vendor platforms can enable healthcare quality to improve. And finally, workforce training programs. If we sort of think about the fact that we have had low information technology adoption in healthcare practices up until now, if every doctor in America turned on an EHR tomorrow, we would have a shortage of workers who are health IT practitioners. So we have a lot of people in the United States that are IT people. We have a lot of people in the United States that are health people. But there's that sweet spot in the middle where if EHRs were turned on across America, we would have a real challenge supporting all of those different IT infrastructures. And so the workforce programs are focused on university-based training, community college training, and curriculum development and a competency exam that will specifically train individuals in health IT. In terms of just generally telling the story of high-tech adoption, I just wanted to point out my office is there near the top of the arrow. We were necessarily, as an overarching office, focused on provider adoption of health information technology first. Obviously, as a consumer, you can't tell me to go into my provider's office and ask for an electronic copy of my record if, in fact, they have not adopted an electronic health record. So our office specifically focused on provider adoption first, and then necessarily in the wake of provider adoption, we're now focused more on consumer e-health and some of the great things that Mr. Morton talked about from overseas. And so I just wanted to show quickly that there is this increasing slope of provider and hospital adoption. You can see back in 2008, before the Recovery Act, we were way down below 20% adoption of electronic health records for office-based physicians. You can see now a dramatic slope as you approach 2011 after the implementation of all of our Recovery Act monies towards these grants that adoption is taking off. And that's the kind of hockey stick that we want to see in order to get to a place where we can do some things like they're doing in Denmark. Again, hockey stick taking off in rural practices and small hospitals. Again, 51% of individuals who are in private practice in 2011 said that they were interested in and intended to apply for meaningful use dollars. 51% of providers across the nation. That was back in 2011. It's significantly improved since then. And you can see that 85% of hospitals, which as we all know are basically the critical point in all healthcare across the nation, no matter what kind of community you're in, are all focused on EHR adoption. So up until this point, the EHR Adoption Incentive Program has provided a lot of support for many, many hospitals and office-based physicians across the nation. 74,000 hospitals and critical access hospitals have been paid in the Meaningful Use Incentive Program. 287,000 plus have registered for the Medicare EHR Incentive Program. $3.6 billion and $3.3 billion in Medicare and Medicaid respectively have been paid out in incentive payments for providers. So there was at the one time sort of a, I'm not sure if I want to do this, I don't know if I'll get paid piece. Folks are getting paid. They are being incentivized to adopt electronic health records, and we're truly moving the needle on advancing our healthcare system into a technologically based and advanced system. You're probably familiar with the concept of meaningful use, which, as I like to term it, is basically the idea that you don't adopt an electronic health record into your practice and just leave it sitting there on the shelf. It's sort of like how I have an elliptical in my garage that's got a whole bunch of different things piled on top of it that I'm not meaningfully using, right? So the idea is to create a situation where meaningful use actually incentivizes people to move the technology that they've developed or that they've adopted into their practice so that they can, in fact, focus on increased quality care. In terms of consumer engagement in Meaningful Use Stage 2 just recently came out, and it came out with some really cool things with regard to patient access to their own health data and engaging patients on a regular basis. So baked into Meaningful Use is the idea that an individual should have timely electronic access to their personal health information. Morten talked about the idea that the folks over in Denmark have a 14-day window at which time they are then able to access their data. Right now, most people in the United States don't even realize that they have a right to access their data. Okay? So that's something that we're working on promoting is, number one, you have a right to your data, regardless of whether it's in a paper-based system or in an electronically based system. You have a right to it. It's your data. If you hadn't walked into that office, they would not have data on you. So that is your data. You need to be using it. It needs to be available to you in a timely fashion. Electronic hospital discharge instructions and clinical summaries. The number of times that I've walked into my primary care's office, nodded, smiled, said I'm going to do the things that she just told me to do, and then walked out and went, I have no idea what I'm supposed to do. Right? If I could get access to those things electronically, like I can my bank statement, I don't necessarily go to my bank statement to find out how much is in the bank. Sometimes it's the nitty-gritty data. Has that last thing I charged actually cleared, right? It's that stuff that you want to refer back to quickly to remind you to be on the right track that is both clinically and financially relevant. So the ability to get electronic access to these kinds of instructions on a regular, ongoing basis outside of the clinical setting is very important because let's face it, we all spend predominant time outside of the clinical system. I spend about 10 minutes in the clinical visit, and I spend this other 99.9% of my time outside in my regular life. So I need to have access to that data. I need to also have tailored educational resources. As I look around the room, I can tell you right now, my clinical issues are not the same as anybody else's in the room. We all have different things, comorbidities, all kinds of stuff. So the bottom line is I need to have tailored things specific to me and my needs that are available for me as educational resources towards my own health care. And then finally, in Meaningful Use Stage 2, we came out with the idea of view, download, and transmit of your data. So, again, most people don't necessarily know that they have a right to their data, but now in an electronically based system, you can start to view that data, the referring back to it that I talked about. But I shouldn't have to just refer back to it and be able to see it. I actually probably want to take it with me in some form. And we talked in the previous session about sort of mobile and the idea that mHealth is going to be critical towards the advancements that they're making in Denmark. Similarly, we want to be able to download it securely to mobile devices or to an online personal health record or what have you. So viewing and downloading is great. But finally, I might not only be going to see my primary care provider. I'm probably going to see specialists in the hospital and things like that. So the ability to transmit is also going to be incredibly important. So we shortened it to VDT, but the bottom line is view, download, and transmit is a new component of Meaningful Use that's going to be very critical towards patient engagement into the future. One of the tenets of our office is that health IT supports consumer engagement. A lot of providers don't necessarily know how to engage their providers more fully, and we feel like information technology can enable that kind of consumer engagement. It can create a situation where patients are partners in their health care. So it's not necessarily the paternalistic thing that we constantly experience when we go into the healthcare system, but that we can now act as partners in my care. It helps with care coordination, as you all know. The bottom line if an individual goes into the healthcare system and they are now going to specialists and hospitals and things like that. That's a lot of data that's being sourced in different places, but also needs to be coordinated. Communication with providers, absolutely key. If an individual has a paper file on this desk here in this office, there's no way that that provider down the hall is going to have the accurate information about that person. So the communications in an electronically based system are critical. And managing health and wellness, just the general day-to-day, how is it that I'm doing, how is my patient panel doing, what have you, are incredibly valuable. And so consumer engagement actually generally just equals better care. There's information out there that says that hospital readmissions within 30 days are only 13% with more activated patients. So the individuals who are involved in their own care can actually reduce hospital readmissions for any of your organizations out there. If you can engage your patients, they are less likely to experience a medical error in your system. 19% of individuals versus 36, nearly double for those that are not engaged in their care. Finally, from suffering from a health consequence from poor communication with their providers, only 13% versus 49%. So critical to overarching quality care is the engagement of the patient. Getting them involved, helping them to understand what it is that you're talking about and how their care needs to move forward. So at ONC in our consumer, please go ahead. So that's a study that we didn't actually do, but I would be glad to connect you with it so that you can understand more. The question was on the study, how did we define activated? I'd love to connect with you after just so that I can make sure you get the information that you want. At ONC, our consumer e-health program is focused on the 3 A's for consumer access, for consumer engagement: access, action, and attitudes. So the short version is access, giving people the access to their personal health data. That's something that's going to be revolutionary in healthcare that has really, truly never happened before. But then when people get access to their data, what is it that they're going to do with it? They need to take action. You can't just get access to your data, download it, and not use it. You need to take action with your data and be more healthy. You have to be the partner in the healthcare that I talked about earlier. So we're supporting the development of tools that help consumers to take action. And I'll talk about some of those tools in a minute. We're also supporting an attitude change. The idea that a person goes into their medical practice and they're seeking care and they don't necessarily feel like they are empowered to ask for a copy of their record. They may feel like their question is a dumb question or what have you. Empowering people to feel like their provider is welcoming them in as a partner in their care is critical. But similarly, we also have to change the attitudes of all of our providers out in the healthcare sphere. Providers need to feel like they can welcome in their patients and that the patient wants to be engaged, because if the provider is focused on the quality care that they all went to medical school for, they need that patient to do the things that they both agreed to do inside that clinical visit when they leave. So attitude changes on both sides are going to be vitally important. However, there's a difference between today's reality in a health IT-enabled system and the potential for e-health and consumer e-health. 9% of people have a mobile app to manage their health. 10% have a personal health record. 20% have access to their health online. 27% have tracked their weight and diet and exercise online. But I would guarantee you that if we took those numbers to this audience right here, most of you have a mobile phone, probably a smartphone. Most of you have a laptop. So you can see there's a difference between the number of people that actually have a PHR and those that have the technology, and what the then potential for consumer engagement is in an IT-enabled environment. Because 80% of people internet users are using the internet to seek health information. So you can see there's a tremendous opportunity there. Use of mobile has doubled in just 1 year, and 52% of people would use a smartphone to monitor their health. The convenience of meeting people where they are with the device that they've got to help them manage their health is critical. 65% of people are interested in using a medical device to monitor their health. The Fitbits and the pedometers and all these other kinds of things, the remote monitors and things. So people are not necessarily averse to IT. Now, the blue button was mentioned earlier in a different context. However, I have a different context for it here. Blue button is a new brand name for patient access to personal health information. Many of you, how many of you are familiar with the blue button, just out of curiosity? So you know the story, basically. The blue button, initiated at the VA, was basically a quick way for them to say, I think people probably want access to their health data. We have veterans that are in and out of the veteran system all the time. They both go to VA hospitals, but they also go to private hospitals outside of our system. They have a lot of issues that they need to manage as a result of their different health needs. They need to have access to their data. So the VA initiated a simple way for people to digitally and securely download their data. The blue button has actually moved over from the VA to the Department of Health and Human Services and over to ONC. ONC is focused on consumer e-health, and this is now a consumer e-health initiative. The Blue Button Pledge Program is an organization of companies and hospitals and organizations like all of you that have dedicated themselves to empowering individuals to be partners in their health through health IT. And so the Blue Button Pledge community is broken down into two separate groups. There are data holders and non-data holders. Data holders are those organizations like the lab, the pharmacy, the hospital, the primary care physician who have data about you and can grant you access to your data. The non-data holders are those organizations that are supportive of health IT and all of the things that it can accomplish, and they have large constituent bodies that they can reach out to and share information about health information technology more broadly. So the message is going to get out there either way. Either the data holders are going to grant the access and begin talking about the fact that you have a right to your data and here's how you get it through my organization, or organizations like AARP and others are going to say, guess what? You have new opportunities in your health care. Here are ways that you can be engaged. Sure, Par.
Are they having trouble getting the data holders to invest in this type of capability? I mean, is there like a ramp up in terms of showing them the value, or are they all on board?
Is there a challenge getting the data holders to invest? So the simple answer is no. One, it has been proven by the VA. And basically what happened in the VA example is the VA set forth this blue button. They didn't really advertise it at all, and they just sort of put it out there, and people kind of tested it out, and then all of a sudden word of mouth spread, and people were pulling for it. And other organizations started to hear about it and called the VA and said, hey, listen, can we do that? Like, can you do that? And, of course, the answer is yes. And so organizations like Kaiser, that you probably know of, United, CMS, Department of Defense, are all releasing data on a public sector perspective. The private sector, a lot of these EHR vendors, they have the ability to just allow you to turn on the portal piece that allows that secure access to the information. Quite frankly, a lot of times it's just that some provider organizations have not taken the step to turn it on and therefore enable it for their populations. So the technological uptick, I don't think, is really an issue. There are vendors that are still working on it, but the bottom line is meaningful use is going to require it. So regardless, it's coming. In the back.
What are the incentives you're using? Because do you have the power to you can't make the legislation power and get people to adopt that? So you're pledging people, but the incentive is that what you're using in your
So the question is, what is the incentive we're using to motivate people to even do this? The pledge program, interestingly, started before Meaningful Use Stage 2 came out. So we were basically going on the altruistic vision that it's a good idea for you to allow patients access to their data. It's often been said that the patient is sort of the most underutilized resource in the whole healthcare system. And, folks have said there have been studies that show that if you allow access to personal health information, an individual will find up to 2 things that need to be changed in their record. Now, it could be little stuff like Damon is spelled with an E instead of an O. But it also could be like you operated on my right lung instead of my left lung. And that's the kind of thing you don't want to proliferate throughout the healthcare system. So in terms of motivating people, it was very easy for us to recruit organizations to come to the pledge community because there is this sort of it's the right thing to do factor. Now, with Meaningful Use Stage 2, there are actually requirements that coincide with allowing patient data access. So they sort of run in parallel to each other and are supportive of one another. Mm-hmm. So it's not too early to do that. I am not working on it specifically. I would love to connect you with the folks in our office that are considering the mobile health issues. But that's definitely one of the things that we need to address. Because as I said, you need to meet people where they are. And quite frankly, I don't always want to sit down to a computer or a tablet and have to find internet access to get online to log into my patient's portal. I would love to have an app right on my phone, and I can be sitting in a room just like you are, dialing in, when I should be paying attention to who's on stage. So one of the tools that I told you I would tell you a little bit about some of the tools. One of the things that our government has in its toolbox is the ability for every single department across government to issue challenges. There's a prizes and challenges mechanism that the president put forth that basically says, we don't know all the answers. We can crowdsource the answers. If you just tell us what the problems are, we will prop up a situation where you can win a prize for having solved a challenge that we have put forth. So on challenge.gov, you can find all kinds of healthcare challenges, but literally you will find challenges in Department of Justice, Department of Education, Energy, you name it, they're all out there. It's very interesting to see the things that the government is trying to crowdsource solutions to. One of our recent ones was the Blue Button Mashup Challenge. So I've talked a little bit about sort of meeting people where they are, having people have access to their data. But one of the things that we realize is as you give people access to their data, if they're anything like me, and I'm not clinically trained, I might not understand everything that I see in my data. So you need to help me to understand what my data means, what it looks like on a real basis to someone that's not clinically trained. Mash it up with some stuff that's publicly available. HHS has vast troves of publicly available data. Healthdata.gov can give you all kinds of different data sets of things that have been collected on a public basis that can be used for any innovator out there that needs to create a solution. And so what we did with the Blue Button Mashup Challenge was we simply said, take my Blue Button data, mash it up with publicly available data in order to help me to understand it. The winners of our Blue Button Mashup Challenge were Humetrix's iBlueButton. Intelligent Decisions put up an app whose name escapes me at the moment. And Instant PHR is put forth by Get Real Solutions. So we sourced 3 solutions to the Blue Button Mashup Challenge. Now there are 3 tools for every individual to use to download their Blue Button data, put it into an app, and they can now utilize it to understand their own clinical decision making when they are outside of the clinical system. Another thing that we've been trying to do is, in support of health IT adoption, not just acknowledge the fact that the provider needs to adopt the IT, but the individual needs to ask the provider to adopt health IT. They need to say, I'm interested in having IT be a part of our clinical encounter or what have you. I need to figure out the ways that I can manage my children's immunizations, all of my different comorbidities or what have you. Let's figure out how to do it. But the simple fact is, I'll be honest with you, if I called my aunt in Kansas City right now and told her what I do for a living, she would have no clue what I'm talking about. So the thing is, we wanted to make sure to demystify what health information technology is for the regular person. And the best way to do that is with an entertaining and simple video in a cartoon form, as a matter of fact, that will allow people to sort of approach the topic without being scared off by the fact that it's IT. So what I'd love to do is show you this health IT animation. I'll tell you a couple of quick facts about it. We used an expert panel of patient engagement folks, providers who are using IT, and all kinds of different folks to help us to hone in on the message that we were trying to reach. We've considered everything from the imagery to showing, as you can see in the bottom left, the security that's available through IT-enabled solutions. So I'm going to go ahead and switch to the video right now and let you just take a quick look at the resource. I will tell you before I switch, though, that this video is your video. We made it. but we want you to use it, okay? This is not something that should sit on healthit.gov forevermore and never be touched. We want you to reach out to your constituent bodies and say, let me just give you a little taste of what it is that I'm talking about if you're unfamiliar, right? So use this to support your own messaging. And give me a moment while I move over here.
How you manage your health is about to change for the better. Medical breakthroughs are helping us live healthier and longer. Advancements in technology are giving us the tools and resources to take control of our health. Health Information Technology, or Health IT for short, is upgrading our healthcare system for the 21st century. Today's technology is freeing us from the confines of a paper world, giving our doctors, nurses, and ourselves the flexibility to access and share our health information securely when and where it's needed. It's a big leap, but not a new one. Throughout history, technology has changed our lives, getting us where we need to go faster, saving us time, and improving how we communicate. It's time healthcare caught up to the way we live the rest of our lives. The good news is that Health IT is reshaping healthcare, creating a smarter, more responsive system, reducing paperwork, saving time scheduling doctor's appointments, and improving the way prescriptions are filled. Health IT has the potential to bring your health information together from multiple sources, so everyone who's caring for you is on the same page, not pages, and that's a good thing. As technology advances, you'll be able to securely connect with your doctors online to review test results, manage chronic diseases like diabetes, and make a shared plan to keep you healthy. Progress like this means better communication with your healthcare providers. Suppose you have a new doctor who needs the results of a past checkup, or your father forgets which medicine he's supposed to take, or your child's away at camp and has to go to the ER. Having online access to you and your family's medical history can save more than time. It can save lives. Having the complete picture of your medical history is vital to managing your health. Health IT gives you, your loved ones, and healthcare providers access to the big picture, so you can make decisions together that are right for you. Now's the time to take that step into a world of better communication and greater convenience. Having secure electronic access to information at the right time and right place can help everyone get the best care. Health IT, it's good for you in more ways than one. To learn more about how Health IT can give your healthcare a 21st century upgrade, visit healthit.gov or ask your healthcare provider how they use Health IT.
All right. So that's the gist of it. Trying to get individuals who are not as entrenched as you and I are to understand what it is that we're trying to accomplish with them and on their behalf. So I'll just close with a couple of things. ONC's future plans, better coordinating our federal partners. We have a lot of different health IT initiatives across the government. It's very important that we understand what it is that we're all trying to accomplish so that we can create some efficiencies across our different programs. We want to try to address the needs of the underserved. And one of the things that I always like to say is, in information technology, we can certainly support the underserved, but IT is not necessarily going to be the intervention that someone who is not engaged in their own healthcare for other reasons is going to need. So we need to figure out the ways that IT can support these kinds of communities. However, we should not look to IT to be the elixir that's going to fix everything. All right? We also want to monitor and explore the frontier issues. I talked a little bit about the SHARP projects and how they're looking toward the future. Here are some of our things. We talked about proxy access in the prior panel, mobile health, social media and health. People are online on a regular basis reporting all kinds of crazy stuff, from the spaghetti they had at lunch to how sick they feel that evening, right? Could it be related to what they had for lunch? And are other people saying the same thing? How does social media help us figure out healthcare types of issues? Gaming for health. You've seen pictures of, mature older women who are holding a Wii in their hand, and they've gotten up off the couch and they're now active gaming for their own health? How can we use gaming to increase health? I also heard something about, there's all these World of Warcraft and all this kind of thing where you battle people into the night, and kids will stay up till 3, 4 o'clock in the morning. Gamers are actually starting to develop those games so that the character gets tired as the night goes on, so that the character needs to eat something, because you can't just keep battling dragons and not eat, something nutritious, right? So it's interesting to see how health is proliferating into the gaming industry. Consumer access to cost and quality community data. You heard me ask Morton before, how is it that you guys are utilizing your tools to help consumers to make decisions? And that's something that we want to get to. What is the cost of my care in that part of town versus this part of town? What is the quality data for that hospital over there versus this clinic over here? To help me make the decisions that I need to make in order for me to have the best healthcare outcomes possible. Integrating consumer health data into the PHR. You and I are walking around on a regular basis, again, with all of our little remote monitoring devices. But there is no way right now for all of that great data to get back into the clinical EHR system, and that's something that we want to try to acknowledge as well. Finally, I'll just encourage you to take the Blue Button Pledge. I would love to have your organizations be a part of our mix. We have a lot of great information and webinars. We have tools like the video that I showed you. We have links to the Office of Civil Rights, who has a letter that specifically states that patients have a right to access their health data. So don't let any of your providers or any provider you go to tell you that they can't give you your data because of HIPAA. It's not true. You have a right to access your data, and the OCR letter will help you to defend that point. Also, we're in the midst of creating a lot of materials that folks can use. And so the National eHealth Collaborative helps us to hone messages as well as develop a roadmap for organizations in order to do a lot of their own messaging in consumer eHealth and engagement. Here are just a couple of different ways that you can be in touch with the Office of the National Coordinator. You can feel free to ask any question over onc.request@hhs.gov. You can see all of the rest of the things there. They're on healthit.gov if you want. And here's my information. If you choose to reach out to me, I would welcome any questions. You should feel free to do so at any time. I'll take any questions, and if there are none, I appreciate your time. Thank you very much for staying today.